Skin by Mariya. This
Hi
is Mariya,
everyone.
the beautiful Mariya. Look at her. She's
Beautiful
gorgeous.
Yana.
Thank you.
The same as Yana.
And my camera guy over there, my BF. So I just wanted to mention her address where she's located. Mariya is located within Hair Decor. She's in Rego Park. The address is 92-29 Queens Boulevard. And she's like right in the heart, right by Queens Center Mall. Amazing location.
Yes.
So I've been hearing a lot about PRP and microneedling, and everybody has like misconceptions about the two of them.
Yes.
So I want you to give us a little in-depth detail as to what's microneedling and what's PRP, what's the difference, who's a good candidate for
Yes.
it, all of that, all that good stuff.
Okay. Hi everyone. I'm Mariya. I'm a registered nurse here at Skin by Mariya Med Spa, located in Queens, Rego Park. Today I'll be talking to you about microneedling and this term microneedling that's always used. So Yana, to answer your question, microneedling is a process, it's a treatment where we create micro injuries to the skin using a small needle such as this. It's a disposable needle.
Let's show
I got
them.
my
Come closer. Let's show them this. Oh, I see. Show them the little tiny needles.
Tiny needles.
See that?
Yes.
Yes? Okay. Thank
Using
you.
this electric dermal pen. This one is from MD Pen, and that's the company that trained me.
The best company.
The best company out there.
Yes.
Hi,
I see
MD
them-
Pen.
I see them a lot online. They're very, very famous. Okay.
Yes. They're number one. They're leading. So it helps with skin rejuvenation. It helps with tightening the pores. It helps with overall texture, acne scars. It takes care of hyperpigmentation. It takes care of a lot of skin issues. It's a one-stop shop, I call it.
What about cystic acne?
Cystic acne is not, it's a contraindication. I'll go over the contraindications. There are a few contraindications that some people, I just say I'm not going to do it
Okay.
because it is risky, and I'm always honest with all my clients, and if I can take up the case, I do it. If not, I always consult my medical supervisor. I have a medical supervisor that goes over all my cases, and some of the iffy ones I have to run it by my supervisor.
So Mariya doesn't only work at a hair salon. She works at a hospital. So she's a full-blown registered nurse, just in case anybody out there is wondering that this is like, why is she in a hair salon, right?
Yes.
Okay.
Yeah,
Let's just clear the air.
I call this is my hobby. I love doing this. In addition to skin, I also do hair restorations for men, women,
Yes,
equally.
PRP for
The PRP,
I was
yes.
going to ask you about that. So she can restore your hair. It takes like, what, 6 to 8 weeks to grow in?
Yes, for hair it's a little bit different because you need a couple of sessions. You need at least 6 to 8 sessions depending on, like the bald area.
Right.
Skin is much better in terms of time and turnaround. So at least 4 sessions is what's recommended for people with any kind of skin issue, and every client is individualized. I have to look at the skin, assess the skin, and make my own individualized plan for the patient. For the client.
Wait, I was going to ask you, do you like consider us patients or clients?
In the hospital, they're patients, here they're clients.
Okay, one more. Okay, we have a lot of questions.
So,
Guys, if you have any questions, are there people watching?
So
Okay,
I
if
just
there are any questions, please guys ask and we will respond to you. And camera guy, if there's any questions, you can read them to us, okay? Don't be shy. Okay. I have a question.
yeah,
Does this cause a lifting effect?
it does cause a lifting effect, and I'll tell you exactly how it does that. So we're gonna talk quick because we're gonna get started on
Yeah,
the
we gotta
procedure.
draw my blood. We gotta go inject my face, not my face.
Yes, so the depth of this electric pen, derma pen, goes anywhere from 0.25, which is very mild, and up to 3 millimeters depth. So it depends on how deep the acne scars are and the wrinkles, how deep they are. So the comparison between a dermal roller that people use in the home and this, yeah, it's a huge, it's a very big difference because dermal, you use that? I think you saw that too, right?
Yeah.
Yeah.
Shout out Rhode Island Field.
Yes, I have to try that one too. But to be like quick in terms of comparison, this one has 17,000 RPMs. How fast
Sounds
it
like
goes
a race
per minute.
car.
Yeah, it's like a race car. 17,000 RPMs, which means it's going to capture a lot of the surface area and quicker. creating a lot more channels for all the hyaluronic acid, for all the PRP to go in. Whereas the dermal roller, it goes in at an angle and it's really not sterile. It goes in and out of your skin basically, and it could tear your skin. That's like the basic difference.
So you really have to know what you're doing.
Yeah, and
Okay.
this goes straight in. This goes straight in and out, and precise.
So is that where you put my blood?
No,
Okay.
this is creating the channels.
Okay.
I'll show you how the blood goes. So here at Skin by Mariya, I really like to promote the PRP because I feel that it's the very natural way of healing your own scars, your
It
own
is,
skins, and
yeah.
your imperfections. And there's really no side effect because it's your own autologous product that goes on your skin, as opposed to all the chemicals and all these other products that are out there for you to use. So how it works is that I would draw 2 tubes of blood from you. Quickly, we're gonna do it now.
Do I get a cookie?
Yes. Hold on a second.
Hey, I was kidding. Oh snap, she really has cookie. This is for all the blood drawing.
I read your mind.
Thank you. Look at that. This was for Valentine's Day, obviously.
Yeah, and this wasn't pre-planned, by the way.
I swear this was not fun.
So the 2 tubes of blood that I draw get spun in a special machine called centrifuge. And then from there I extract the PRP, which is the platelet-rich plasma, which goes into your skin through the channels that I create with this pen. Okay, so platelets are really absolutely amazing because what they do is basically they call the troops from inside your skin. Our troops are fibroblasts, our osteoblasts, our macrophages. They come and they start building the collagen that we need, collagen, elastin. So I'm gonna show you a quick visual here for all the people that are visual to see what that looks like.
Thank you.
Yes, here it is. I did this today, by the way.
Perfect. Look at that, guys. See, she really thought
So-
this through.
3 components of a healthy skin, right? So this is our epidermis, dermis, and our hypodermis. This is a very healthy skin. As you see, this is really straight, the flat surface, and everything. This is the collagen. The little things are elastins, and the hyaluronic acid. So these 3 things make up our skin. And as we
And
get
the bump-
older,
Yeah, the bumpy one. What
the
is that?
bumpy
Wrinkles?
Yep,
Oh.
that's how wrinkles, because this sags. You see, like a spring. So there's very little here. That's why the skin sags. So this is what we want to correct.
Right.
This is our target. This is our young people when they are like babies, have this kind of skin. As we grow old, it actually we lose and we break down collagen and elastin, as we're speaking now, by the way.
Yeah, gravity. It's all your fault, gravity.
Yes. So there's a few types of collagens. There's collagens that we inject. There are collagens. Type 1 collagen is in our hair and skin. This is what I'm focusing on. And 80% of skin is collagen here. Type 1. Type 2 is the connective tissues. And type 3 is in our muscles.
So, let's talk about collagen for a minute. How do you feel about collagen powder that people buy? Like, I sometimes drink it. I don't drink it all the time.
Yes. So all the products that they sell out there, I actually knew that's coming. So I have a question here. Can specific foods or supplements help improve skin elasticity? Unfortunately, changing your diet into taking supplements of collagen does not do
It
it.
does not.
Doesn't
Okay.
do it at all.
So, and this is scientifically proven?
Scientifically proven, otherwise I wouldn't put it here. As you
Okay.
age, the rate at which your skin produces elastin will slow.
Okay, so you hear
So-
that for all you guys out there and girls who take
Invest.
collagen powder and invest a lot of money yearly in collagen and bone broth and all that stuff. It's not going to work.
But
Okay?
however, I'll tell you, proper diet, like if we
That
eat certain
helps.
diets, yeah, it's not gonna make more collagen, but it will decline the loss. So
Okay.
you will lose it slowly.
So it'll delay the aging
Yeah,
process.
delay, yes.
They want to delay.
So our diet should be actually consumed of protein. We need to eat a lot of protein because these collagen and elastin, they're types of protein. So for all the vegans or vegetarians, they have to supplement protein.
Right.
So,
And they eat a lot of beans, nuts, avocado.
yes.
I tried it. It wasn't for me. I was losing in my hair. My nails
Yeah,
were
it's not
breaking.
for everybody. It's really not for everybody. My daughter was a vegan for about a year or 2 at age 13, 14, like that. I don't know how she did it, but she changed right away when she saw her hair thinning and everything.
Yeah.
So this is what we're gonna do for Yana today. We will restore her youthful skin.
Yay!
Although she has amazing skin, by the way, we'll make it plump, juicy.
I'm still aging, so I'm not different than anyone else.
Yes.
I am aging. I'm gonna get, wrinkles, this and that. I would love to delay the process.
Yes.
And I've been in touch with Mariya over here for like ever. And finally, I made time to come here. So I'm excited to work with you.
Yes.
And let's see where this takes us.
Yes. I also want to quickly tell you that there is going to be some products that are recommended to use after microneedling.
Okay.
And I will go over that with you once we finish.
Okay.
But the advantages of doing PRP microneedling as opposed to regular hyaluronic microneedling, that was your original question,
Yes.
I believe, before the live, is that with hyaluronic acid microneedling, which is the regular microneedling, you produce 200% of collagen. It's proven that your body makes 200% more collagen, but with PRP microneedling, it's 1000% collagen that's made.
Wow.
So it's a difference of 800%. So which one would you go with?
Of
course,
1,000, yeah.
PRP, yes.
So is this instant gratification, or how long does it take to see the collagen rebuild?
Yes, it takes 4 to 6 weeks for your body to start making that collagen. Therefore, the sessions should be 4 to 6 weeks apart.
Got it.
Yes.
And you recommend 4 sessions?
4 sessions. For you, I would get away with like maybe 2 or 3 sessions.
I'll do
You
4.
have really good skin.
Guys, we are going to be offering only the group members of Beauty Addiction NY really great rates. We're not going to discuss it right now, but we will come back to you in part 2 and 3. So please, we're going to turn this off in a few seconds. So come back for part 2. We're going to go draw my blood.
And we'll get the consent and all of that.
Yeah.
And we'll talk about contraindications.
Can we just do the blood during this live? You want to do it now?
We could do the blood once I numb you.
Once you numb me.
Yes.
Okay. So we're going to actually go and wipe off some of this bronzer I'm wearing.
Yes.
Numb me. And then while I'm numbing, we're gonna go back live. So come back, stay on the group, guys. Don't leave.
Yes.
You don't want to miss this. I'm gonna get poked in my face.
You'll be fine.
I'm excited. I'm in good hands. All right, guys.